right, 10 minutes before 11 o'clock. Thank you for tuning in. Tomorrow's Veterans Day, and I can't think of any other choice that any of us ever make that is as selfless as deciding to put yourself in harm's way for the good of other people. And that's what every veteran has done at one point or another in his or her life. They have decided to say, you know what? If there's a war, I'm going to put myself there, and if I don't come back, well, that's just the price I pay. Many of them do come back, and many of them come back with injuries, and sometimes those injuries are invisible. We used to call it battle fatigue or shell shock, and we have learned that it's a real and serious condition. And as we remember our veterans tomorrow, I wanted to point out, we've actually had guests in here, and I'll be real quick with this. A husband and wife. He was a Korean War veteran. He had lived with PTSD all their married life. She never knew him any other way. When they heard about PTSD, she said, you know, that sounds like you. He denied it. He resisted it. He didn't want to go to any therapists, but she finally persuaded him, and he did. So they came in here to tell their story about how much it improved his life and their relationship. It was an amazing story, and it kind of opened my eyes to, wow, this is a real thing. Dr. Stuart Hoffman knows it's a real thing. He's on the phone with us right now. He's talking to us about how research is making a difference for veterans who have PTSD. Just to give a few credentials, Dr. Hoffman is the scientific program manager for the VA Research Brain Injury Portfolio, and his credentials go on and on and on. Good morning, Dr. Hoffman. Thank you for being on the air with us today.
Good morning, Larry and Robin. Thank you for having me, and thank you for honoring our veterans.
Where are you calling from?
I'm calling from Washington, D.C.
Okay. The district that might become a state soon, I heard, right?
That's for the people to decide and to make those decisions.
Doctor, it sounds like there's a delay in when you say something and when we hear you, so I apologize if it sounds like we're talking over you. We don't intend to do that, but I think that's what's happening. So tell me about the research and how can our veterans benefit from it?
Thank you for asking that question. That's a great question. The VA not only does research in the two topics that you mentioned, traumatic brain injury and post-traumatic stress disorder, PTSD, but it also does research across the spectrum of conditions that affect our veterans. Everything from cancer, cardiovascular disease, to stroke. In your own state, we have a polytrauma rehab center in Tampa that does a lot of great research on the most severe forms of brain injury and polytrauma. Excuse me. We also have a center up in Gainesville, the Gainesville VA, that is studying how to do rehabilitation on veterans who have both stroke or TBI, and how to improve their mobility. So it travels the whole spectrum. And then we have other programs such as the Million Veteran Program that is collecting the genomic information of veterans. Is the largest and first of its kind in the country or even the world, and it's going to help personalize the medicine for our veterans.
Okay, so it sounds like the science behind the solutions of the problems with the PTSD and other, and I know it's two different things, but brain injuries and PTSD, are they? We don't want to make any blanket statements, but do they have different sets of challenges for the doctors?
That's a great question. Both are very complex conditions. There's a lot more research done on PTSD going back to the Vietnam War, and TBI is sort of the new kid on the block, and there's nothing more complex than the brain. So often it takes a long time to develop therapies, or even before therapies, to understand the nature of the problem. Recent research may suggest that having a TBI, having a traumatic brain injury, or multiple traumatic brain injuries, may make the brain more susceptible to getting PTSD.
Oh, really?
And so So, I mean, there's all sorts of new research, and you can have PTSD without having TBI. You can have TBI without having PTSD, and TBI itself is not just your ability to think and understand. It can affect the way that you can affect your vision. It can affect your hearing and balance. It can be a cause of chronic pain and other psych health conditions outside of PTSD, such as depression. So we're talking about very complex injuries, whether it's PTSD or TBI, and all the comorbidities that go along with those conditions.
So as you are treating the veteran for these conditions, are the spouses or the significant others able to be coached as to what to expect, how they can help their veterans in the process so they don't give up on them and leave?
That's another wonderful question. Being a caregiver of someone, let's say, with TBI can be very stressful and very exhausting. And the VA, and I encourage people to go to their local VA, have many programs that can assist caregivers. In addition, VA research, for who I work for, has a very mature research program that is trying to improve the lives of caregivers and improve the tools that they can use to help their family member and veterans.
Is there research that indicates that somebody is more susceptible to PTSD? If I don't know, if somebody's like emotional all the time, or I don't know. I mean, it almost sounds like it would be hard to not be traumatized by witnessing something traumatic. Especially if it was if you were with somebody in battle and he died and you cared about this guy, or I mean that would be more traumatic, I think, than seeing, I don't know, a cat get run over or something. I love cats. So. I'm just trying to compare the two. You know what I mean? Is there a way to test it?
Yes. And, if you see a family member that has increased anger or irritability, they're isolating themselves socially. They're using or misusing substances much more frequently, and they're having problems with relationships, problems at work. They have symptoms of depression, sadness, guilt, survivor guilt. You need to get them to see a clinician. You need to get them to their local VA, and it's so critical. These veterans deserve our help, and they deserve the care.
The one thing I think I heard when we had our men coming back from Afghanistan is that there was a question asked of them regarding, do you think you need mental therapy? And just because they wanted to get home, they all said, no, I don't need anything. I'm fine. So they might have already kind of written it off, but I think it's almost a point of embarrassment to say, yes, I think I have a mental issue, right?
There's been some stigmatism in the past, but I believe that we've overcome that.
I hope so.
It's necessary. I mean, the VA offers many evidence-based treatments that can help people with PTSD as well as TBI.
Yeah.
The main hurdle is coming in and getting that help.
Doctor, with half a minute left, can you give us a website so we can look up more information?
Yes. The website for the Office of Research and Development is www.research.va.gov. That's www.research.va.gov.
Okay, great interview, great information. We'll share this online. Dr. Stuart W. Hoffman, thank you so much. We'll be right back.
This is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Fox News Radio, I'm Lillian Wu. After months of saying harsh things about each other, President Obama and Donald Trump holding their first face-to-face since the election this morning.
The much-anticipated Oval Office meeting between the president and the man who will succeed him is aimed at ensuring a peaceful transition.
And I'm looking forward to doing everything that I can to make sure that the next president is successful in that.
The president, in remarks in the Rose Garden yesterday, acknowledged that he and President-elect